Hi there, I'm Dr. Chung and welcome to your friendly proctologist. On this channel we discuss the health of our bottom ends and I hope you can relate or learn a thing or two. Today I want to discuss the hemorrhoid surgery, or often known as the hemorrhoidectomy, right? It's a very long word, but if you're to break it down, hemorrhoidectomy is hemorrhoid, and then the ectomy is the removal of. So removal of your hemorrhoids. So your hemorrhoids have gotten to the point where their symptoms are now bringing you trouble in life. And you've now come to the point of discussing with your doctor about whether this treatment is the right thing for you. And I think that a very thoughtful discussion should be had before you decide to have this kind of surgery. Why? Because any surgery is a big deal. Usually the surgery is done while you're completely asleep, so a lot of medications involved, side effects from that. You should always have a discussion regarding those concerns. And then the recovery is also one of the most difficult in terms of the place of where the surgery is being done, right? We're talking about the most sensitive part of our body. Tons of nerves there, very concentrated, and they typically, will sound their alarm, sound their horn so that your brain can't ignore that type of intensity. So this is not something to be taken lightly, right? Well, let me give you some information. Hopefully at least this will bring forth some questions so you can discuss with your doctor, and also give you some heads up as to what you may expect. So the hemorrhoidectomy is done in the operating room, right? We need a place where you can be sedated or put to sleep because you do not want to be awake for the surgery. And it's in your bottom end and you don't want to be moving around a lot. The bottom end is a very small space, and these movements, this work that needs to be done in there, need to be done without you moving around. And plus, you don't want to be awake for any of this stuff anyway, right? It all makes sense. So how is the surgery done? Well, after I look inside your bottom end, I first take a look at where the biggest hemorrhoids are, and I kind of work from the biggest to the smallest. And the ones that can be cut out are the bigger ones. Small hemorrhoids really can't be dealt this way. Well, take that back. You can always cut something out, right? But should it be done? That's the real question. And I believe that smaller hemorrhoids don't need to be cut out and have you deal with a bigger recovery because of more work done to it. And I think there's other treatment methods which are much more humane and allow you to recover faster. So once I've identified one of these hemorrhoids, what we do is, well, let me take you to the computer. So let me take you through an explanation of how this surgery is done, and thanks for being patient with me while I draw for you. But usually when we talk about identifying the hemorrhoid, usually that hemorrhoid is going to be bigger on the inside, but sometimes you may have a little bit of extra skin coming to the outside, right? Like that, like a skin tag is what we may call it. And it'll be linked to another hemorrhoid on the inside, like that. And so these are the ones that are ideal for the hemorrhoidectomy or removal of the hemorrhoid. And let me show you in another picture what this looks like. Once again, we've got the picture of our anus here, and we have our muscles for our control, and then this is our bottom end here, the buttock. And the hemorrhoid, if we were to look at it from a side angle, the extra skin tag would be located here, and then the larger hemorrhoid would be located on the inside of our anus. And so what we do is we remove or literally cut out the hemorrhoid from the beginning up here all the way to the end here, and this would all be removed, right? When you remove it, it may look something like this. So I've taken you a little bit off the edge of the paper here so I can draw you another picture. And our anus is kind of like a cylinder, so if we drew it like this, right, and this is the outside, and if we say that the skin tag is located here and the hemorrhoid is on the inside, it may look something like this. We literally cut out the hemorrhoid from beginning to end, and then we sew you back together using stitches. And the stitches are absorbable, and most of them do come out during your recovery, but if there's any stitches left, it's absolutely no problem to get them removed later on. The purpose of the stitches, however, is not to have the wound close with a really pretty cosmetic effect. The stitches, the purpose of them are to provide bleeding protection. So if you can imagine, when we cut on either side of our hemorrhoids here, the blood vessels or the hemorrhoids are going to start bleeding from the edges, and that could be a big risk in terms of the recovery of the surgery. So the stitches are there to help seal off the blood vessels and tie them off so that we don't get problems like life-threatening bleeding. And the risk of life-threatening bleeding from a hemorrhoidectomy is less than 1%, and it's for reasons such as these, because we perform them this way. So I hope that helped you understand how the surgery is done and a general context about the surgery itself. This surgery, in my opinion, should be taken very seriously, and the decision to do the surgery should also be taken with some considerable thought, because the recovery is a very tough one. I think that in terms of the primary objective with the surgery, what should it be done for? It should be done for reasons because this hemorrhoids have gotten big enough, or they've been giving you enough problems that the getting rid of the source of the problem, which is the hemorrhoid, would give you an improved quality of life, so you can go back to exercising, so you can go back to walking or working, whatever you need to do. There is a second objective, in my opinion, which is cosmesis, how it looks. Definitely people become very bothered by the way these things look. If they have a big skin tag coming out, can I do a hemorrhoidectomy for it? The answer is yes, of course. I mean, I know there are lots of doctors, when you ask them, they'll say no, there's no purpose or room for doing this for the looks. I mean, they're not plastic surgeons, and I understand that perspective as well. But when that extra piece of skin is getting in the way of your hygiene, is really becomes something that it's weighing on your mind all the time, and it bothers the heck out of you. I think that when those situations come about, performing a procedure, whether it's smaller in the office or in the surgery, in the operating room, those are both methods to help people stop their suffering and get better, right? Isn't that the whole purpose of it? And thank you so much for listening with me today. I really appreciate you, again, bringing those questions forward, and I hope this video answers some questions for you and gives you some of that background information to arm you with some confidence. Well, thank you so much. Please like and subscribe to the video. I appreciate you being with me today, and I hope you have a good one. Take care. Bye-bye.